Our annual International Health Lecture is one of the main events of our calendar, and this evening it's to be given by Professor Janet Hemingway. Just to say, before I introduce Janet, that after the lecture there'll be some time for questions and answers, and then subsequently a drinks reception outside. I need to just let you know that the event is audio recorded, and so that means that if you're going to ask questions, you'll need to use the roving microphone. I also need to tell you that if the fire alarm goes, the exits are at the back there. That's hopefully useful but not to be used information. And I'd like to ask you now if you would just have a look and make sure your mobile's turned off. So, to introduce Janet Hemingway, she's the director of the Liverpool School of Tropical Medicine, but also the international director of the Joint Centre for Infectious Diseases in Jezan in Saudi Arabia. And particularly relevant for this evening, she's the CEO of the Innovative Vector Control Consortium, which is a product development partnership that has worked and works with industry to develop insecticides and diagnostics for malaria and dengue and other vector-borne diseases. Her studies on resistance management have greatly influenced the use of insecticides in disease control programs worldwide. She's promoted the use of evidence-based monitoring and evaluation strategies for insecticide resistance. And this has guided and improved international policy on vector control strategies for malaria and other vector-borne diseases. Her approach to resistance analysis has contributed to a greater understanding of vector resistance and has minimized its effect on human mortality and morbidity. Professor Hemingway is a Fellow of the Academy of Medical Sciences and of the Royal Society and of the American National Academy of Sciences. And we're greatly looking forward to her International Health Lecture entitled Health Impacts of Product Development Partnerships. Janet.
Thank you very much, Robert. And thank you very much for the invite to sort of give the sort of talk here today. You've all had the title, so I don't need to dwell too much on that one. I'm going to focus really around malaria for the product development partnerships and focus very much on the partnership that I actually run. But just to start off to say, if you're looking at malaria, we've got three main product development partnerships. The Medicines for Malaria venture, which does the fairly obvious thing that it says, develop new medicines or drugs for malaria. The Malaria Vaccine Initiative, again, fairly obvious what that one does. And the Innovative Vector Control Consortium, which I run, which is looking at the third part of the triangle and actually controlling the mosquitoes that actually transmit malaria. We don't just focus on malaria, we also deal with other vector-borne diseases, leishmania, dengue, trips, chagas. Many of those major tropical diseases are actually transmitted by insects. So I guess three real parts to the talk on the sort of set here. Why do we need product development partnerships? The role of a product development partnership then in vector-borne diseases, and a little bit about the progress that we've made of late. So I always start with sort of one slide that if you don't remember anything else of the talk today, I think this is the actual sort of slide that you will remember. Because I've talked about why do we get market failure? We need new paradigms. Industry talks about needing a market rupture. And then I see many sort of scientists looking at me and saying, well, what on earth do you mean by that? And then I say, well, you're actually sort of surrounded by them. So if you look at a 50-year time span and start in 1956, because it was a kind of good vintage, some of us were born around that sort of time, and through to 2006, then what were we looking at? Well, if you looked at music at that point, this was the state of the art that everybody would have or aspire to have sitting in their sitting rooms, a sort of player and the sort of vinyl sort of discs. I suspect most of you, apart from the real aficionados, don't have that anymore. Most of you might have a CD player, but now they're getting a bit old-fashioned, and most of us would now be with MP3 players. So there's been a real sort of shift in the market there. Well, what about sort of some of the other areas? Telephones, 1956, this was the state of the art. One of those big black things that you just about strained your finger to sort of set going. They're coming back in terms of the sets. You can buy them in the shops again. But most of you have just been told to turn off your mobile phone. And the mobile phone these days not only acts as a mobile phone, but it's also an MP3 player, and it's a sat-nav, and you can move around through it as well. So a huge, great market shift there. And what about TV? Cathode ray TV, black and white, took a while to warm up and a while to sort of cool down when you sort of turned it off. We didn't have one in 1956. It was a few years after that before we actually sort of got the televisions coming through. And even in a standard hotel room now, this is what you'd expect. So you would think that vector control, for example, if we look at the same sort of thing, what was the state of the art in 1956? Well, it was a Hudson sprayer that people used to sort of pump up, and they would put a wettable powder in there with DDT at 2 grams per metre squared. It was a great invention, great sort of system, state of the art at its time, and the malaria eradication programme of the 1960s was built on the fact that we had this. But like all great inventions, you would think in 50 years that things might have moved on. Well, in 2006, the WHO actually hit the headlines in the New York Times because they'd come out with a statement about what you should be doing for malaria control, for vector control. And what was it they recommended to as policy in 2006? Well, it was actually that you should use indoor residual spraying with a Hudson sprayer, wettable powder formulation with 2 grams per metre squared DDT. We haven't had a market shift, we've had a market failure there. And I think that tells you why you need product development partnerships, because there just isn't the market push there for industry to put the innovation in and take things forward. Academia, left to its own devices, isn't going to produce new materials that actually get all the way through to market. You need to put those two together, incentivise industry, and actually, because they've de-skilled in this area, make sure that the skills we've still got left in academia actually link through into industry to make sure that we get things moving forward. So what about the size of the market then we're dealing with? Well, again, if you just look at the malaria sort of set, if we had persuaded the world that we should be going for eradication, then this chap up here, who many of you will recognise, had the Boston Consulting Group look at what it would cost to go for malaria eradication. And the estimate there of $4 to $6 billion per year, we only spend around $2 billion as it stands at the moment, and that's with the recent upsurge that has gone into malaria control. And of that, the vector control is about 30% of it. So it's about a third of the cost of the programme. The vast majority of that cost being in the insecticides, certainly if you're doing indoor residual spraying, slightly less if you're going through and using insecticide-impregnated nets. So it's not a huge market in real terms. I mean, those numbers may seem quite large, but if we put it into context, the market for public health pesticides is actually smaller than the market for insecticides that we use on golf greens to stop those nasty little insects that chew up the greens. So I think if you then look at where's the push going, industry's going to spend more on developing insecticides and treatments for golf greens than it is for malaria control. So we actually, about 6-7 years ago now, persuaded the Gates Foundation that they should actually support a product development partnership in the vector control area. We're the only product development partnership in this particular area. And so rather than the more focused product development partnerships that you've seen around drugs and vaccines, we actually try to cover quite a lot of territory around formulations of insecticides, developing new insecticides, but also then looking for new paradigms in terms of the public health pesticides, and looking at information systems and diagnostics that will allow us to actually make sure that those insecticides are properly used and the insecticides that we've got at the moment are sort of properly used. If we look at the total cost required for that, then the new active ingredients or new insecticides we're aiming to have out to the market by 2020 at a cost of somewhere between $200 and $700 million. That sounds like a big spread. It's a big spread because nobody's ever developed a pesticide just for the public health market up till now. And so we're having to invent the wheel in terms of making sure that we've got a system that will move through. So some of the things that you have to do for agricultural insecticides, we probably won't need to cover if some of these things are not going out into the ag market. And if they are, we're hoping our industrial partners will cover that cost. Repurposing what's already there. You can't actually repurpose too many of the insecticides that are out there because the most recent agricultural insecticides are very specific and are designed usually to go up through the plant. So if your insect isn't actually sort of eating plants, as most mosquitoes don't, then the insecticides that are designed to go through that route are going to be of very little use to us. But we do want to get better formulations of what we've already got there. And then decision support systems and diagnostics on the sort of set. So if I give you a quick whistle-stop run through those, here's our current portfolio for public health insecticides. And I'm delighted to say that we've managed to get all of the major agrochemical companies involved on that. If we look at this side of this is time, and each of these sections are about a year. So this is about 10 years from start to finish in terms of this coming through. This is the kind of low-hanging fruit in terms of the new formulations. So a few years in, we have the first of our new products coming through with Vestergaard. We have our new products coming through in terms of formulations with Syngenta and Bayer, and those are in late-stage WHO pesticide evaluation. So they will be out there for the market and for the control programs to be buying in this coming year, and a whole raft of things behind that. Here are our new insecticides coming through. We have gone through a very rapid process of screening all of the libraries from all of the chemical companies, and we have 5 new classes of insecticide from Bayer sitting at the starting gate, all of which are brand new classes. They're not currently known. 3 brand new classes which are not the same as these, from Syngenta, and another 3 from Sumitomo, again different again. We're at the earlier stages with Dow, so we don't know yet what's coming through their library sort of screening, and we're using an independent screening company for some of the smaller libraries that are available. So we're going to have will have a huge amount at the starting gates and going through lead optimization and into development and toxicology in this next year. So it's going to be about 4 or 5 years at the earliest before we'll have new insecticides coming out onto the market. And what we need to make sure is that we've got a means of actually utilising what we've got until those new things come through. Outside the IVCC portfolio, there is nothing coming through. So if it's not in our portfolio as it stands, it does not exist. So all of the companies are working with us. This is what is coming through for public health pesticides. We're also looking at value and competition. So the first of the new formulations is coming through for indoor residual spraying. And the big shift there is we're moving from a formulation that lasts not 6 months, but 12 months. But we're also dealing with a fairly naive market that tends just to look at cost of goods. And so when we went through the early insecticides, DDT was a lot cheaper than malathion, which was an organophosphate we no longer use, which at that time was cheaper than pyrethroids, largely because it was a one synthetic step. You can make DDT in a bucket from basic ingredients. You had 3 synthetic steps to get to malathion, and when the pyrethroids first came through, about 15 or 16 steps. The price of pyrethroids tumbled when competition came into the market and when the chemists got better at producing these things and managed to streamline the production sort of set. But we're having to work at the moment trying to persuade the folks who are buying the longer-lasting indoor residual sprays that in fact they should take account of the amount of time these last on the wall when they think about the cost of the insecticide that they're buying. Because if not, then they look at this and say, well, why should we go to a more expensive sort of set? The other side of that is trying to make sure that because we're de-risking the system with industry, we're making sure that we're trying to get the lowest possible price from our industrial partners in terms of them manufacturing this. But we still have to make sure that these companies at least break even or make a small profit if we're going to long-term keep the companies involved. I can't say too much more about what's coming through in the insecticide portfolios because we're clearly in the early stage there and a lot of it is fairly commercially sensitive. So what I want to do now is just switch tack a little bit and talk about some of the diagnostics that we've got coming through and the impact that they're already having on the control programs. Because at the moment, if you haven't got proper diagnostics in there, so you don't know whether your insecticide is working and you're putting the right insecticide on the right place, and you don't know whether your insects are still susceptible to that insecticide, then your programs are not going to work terribly well. So we need to make sure that we've got the right diagnostics and quantification sort of systems in place and that they're fit for purpose. So fancy HPLC systems or gas chromatography systems may be fine if you're sitting in the UK. They're not fine if you're sitting in the Democratic Republic of Congo, where your nearest HPLC is many, many miles away, and it probably hasn't worked for the last 5 or 6 years because they've got nobody to service it. If it breaks down, which it will do at regular intervals, they'll never sort of get it to run through. So what we're wanting is appropriate technology here that we can put the right systems in place. So dealing with the sort of two technologies, I think there are two things that we really need to do there with the quality assurance. Bed nets ought to be straightforward, but sadly, as the bed net market has grown, we're now starting to get counterfeit nets coming onto that market. And you can't see the insecticide, you can't smell it otherwise, and sort of if you want to make sure that you don't have a counterfeit net and you've got the right insecticide on there, you need a means when these nets come into country of being able to detect the insecticide on there and make sure you've got the right thing. Equally, if you're spraying insecticide, you've got a bigger quality assurance job. You're sending the sort of spray teams out. There is an incentive for some of that insecticide to leak out of the sort of system by them selling it to their mates, for example, to put on their crops, rather than pop it on the wall and then you spray water on the wall. It has been known. And you may get sort of teams that don't spray very well. You may also get fairly poor quality insecticide coming in. So at all of those stages, you need to put a decent quality assurance mechanism in place. Well, WHO for many years has suggested that if you can't sort of do your quality assurance using GC or HPLC, then what you should use is a bioassay. Nobody does it. You might think, well, it's simple technology, you're using the insects that are on the ground. But in fact, this is the system here that they're suggesting. So first of all, you go out and collect your mosquitoes. You've got to collect susceptible mosquitoes, mind you, because if they're resistant, clearly they're not going to tell you whether these are working or not. You then put them in a vehicle and you drive them to the insectary, if you happen to have one in country, and you rear those mosquitoes up through larvae into adults. Once you've got those adult mosquitoes, you put them back into the vehicle, drive them back into the field, put a bit of paper on the wall, a cone, put the mosquitoes in there and see whether they die or not. It becomes fairly obvious why people don't use that system. Mosquitoes, once they've reached this point here, usually die in the hot sort of vehicle if they go any distance from the insectary. So you end up with dead mosquitoes before you put them anywhere near the cone. It's a completely silly and unworkable system. So what we wanted really was a very simple system that allowed you to take a sample off the wall once the guy had been in and sprayed and gave you visibly a result that you could actually measure in minutes. And that needed to be quick, accurate, easy and cheap in terms of sort of putting that together. And we wanted visual systems that worked for the three major classes of insecticide that we currently have out there. So that's really DDT and organochlorine, bendarcarb, which is a carbamate, and the pyrethroids, of which there are two real kinds, the alpha-cyano and non-alpha-cyanopyrethroids. So over the last few years, we've developed very simple methodologies to do that, and I'm delighted to say that we now have those quantification kits available. So they all work within minutes. They all cost less than $1 a shot to sort of do these, and they all give you visual results that you can run through. So this is the DDT test here. It's set up on a strip system. So the strip here is calibrated up the side. The further the white area goes up here on the sort of set, you see this one going higher than the others, the more DDT you've got on there. So very quick and easy to run on the sort of set there. A yellow kit for the carbamates. For some of the pyrethroids, we have a kind of blue visible sort of system here in earlier stage development, and we've another one that works on a red colour change on the sort of set. So we've now put these into the field to see whether they actually work in the hands of the folks who are doing them. You obviously start your calibration putting it against the sort of state-of-the-art sort of system and make sure that you've got a good sort of calibration of the strips with that, and we get exactly that. So if we take the DDT test into Bihar states in India, where they're using the system for DDT for leishmania control, the guys in the field can use these very straightforwardly and very easily. And we're now looking at calibrating those and taking those forward with some support from the Wellcome Trust to be able to operationalise those in India for DDT primarily. This is the way we've been running the pyrethroid assay. Here, in fact, in the houses, I think these are around in the Solomon Islands and Vanuatu. We get to go to some nice places in the work on the sort of set. Really easy system. You take a sample off the wall with a bit of tape. You put the tape into a small vial here. You wait 10 minutes and then you look at the colour against a colour chart. And you can produce what we call a heat map here. So we've taken multiple samples off a number of houses. So these are along the line here. This is the combined score for the house. The dark red shows you that you've got the correct concentration. Anything lighter than that in different bands, and clearly this is undersprayed. And you can look at the top of the walls, the middle and the lower, so you can calibrate whether the sprayman's doing his job properly. By putting these in place and using industrial sampling methods, so we use a lot quality assurance sampling system that industry uses for production, we can very easily and very cheaply put in place a system that says, have we got the right insecticide? Is it getting sprayed in the right place? And we can look at this immediately after it's been sprayed, but we can also monitor it over time to see how long the insecticide is lasting for. And visually, you get a really easy sort of means of looking at that as well. So this ought to be all one colour if we were living in a perfect world. Clearly we're not. But when the teams see this, they know that the monitoring is in place. We moved from looking here at 9 teams, of which 2 were working very well and the others really were fairly poor in terms of their spraying. Having put this in for one round, retrained the teams, we've gone back. We now have 8 teams working very well and 1 still not doing too well. So the very fact that you've got a system in there to be able to monitor means that you can get the quality up. And people can look at their own quality and I hope have a bit of pride in what they're doing as well. But it's a great training aid. It needed to be something as well that the folks on the ground could use. So this is technology that you don't need a PhD, you don't need a master's. The guy who's in charge of the spraying, who usually has fairly basic education, can do that. And so taking this out to Bioco, the quality assurance system has been put in place with the folks there. From the island there, they do 1,500 samples, pre and post spray on the surfaces, and the guys from the team really happy with the sort of systems we take through. So I think what we've got there is job well done. You may say, well, you haven't got an exact measure. We don't, but we just use 3 sort of sets. If you're down at 0.1, then clearly you fail. 1 to 5, sprayed but not great, and over 10, and you're exactly where you should be. So they've just got 3 colours that they're wanting to look at within the sort of set there. And again, coming back with that, we made sure that we ran it against HPLC and an absolute correlation between the test kits that we've got and the systems that we've been looking at with HPLC. So I think the feedback's there, the systems are there. What we now need to do is make sure that we've got a manufacturer to take these out and supply these and put them into the system. We also have to persuade the WHO that they're going to take this on and have this as their recommended method. And that, in some ways, is the most difficult bit of all of this, because the old method has been there for so long. We went back and asked the question, okay, well, how do we get this in there? And they weren't quite sure. So they're having to reinvent the wheel now in terms of saying, what mechanism do we need to actually get this now as a recommended test for the sort of system? But at least we've got that in play. So let's move now from the insecticide. I think we've got the job done, at least in large part there, in terms of monitoring the insecticide. But the other side of that is then monitoring the mosquito to see, well, does the insecticide sort of still work? Because the more selection pressure you put on the insect, the more likely it is to produce resistance. You need to be able to react when resistance comes through, and you need to know whether the resistance is important or not. And so we really want to know 3 things. The species of mosquito that we're dealing with, its infection status, and its insecticide resistance status. Now, some mosquitoes are easy, so for any entomologists in the room, they should be able to tell me what this beast is straight off. The stripy legs give it away. But most things are not quite so easy as that, and having a test that you can put on that will split the anopheline mosquitoes, this is not an anopheline mosquito, this one will give you dengue, it needs to be put in place, again, so that you don't need a PhD or a master's entomologist to be out there actually catching the mosquitoes. You need something that you can give to the folks on the ground there. So what we've done there is to go with a molecular approach, a basic sort of PCR approach to take things through. Doing the species identification, where you're looking just across a small number of species, is actually very easy. We've already got the markers to do that. Doing the infection is easy. We've already got the markers to do that. So we can take a 1/10,000th of a mosquito homogenate, pop that into a PCR reaction. We can multiplex that on a simple system, and we can tell you within minutes what species you've got and whether it's infected or not. The resistance is rather more difficult because there are multiple ways that an insect can become resistant to an insecticide. Some of those matter, some of them don't, in operational sort of terms. And so what we had to do was try and put a system in place that identified the mechanisms that matter, and then to try and put a system in place that allowed us to track it. When we started this 7 years ago, they were only just starting to upscale bednet distribution and start with the insecticide programs for indoor residual spraying through the Presidential Malaria Initiative. And it was fair to say at that point that there were little pockets of pyrethroid resistance, one down in southern Africa on the border with Mozambique in South Africa, one up around the sort of Kenya, Tanzania sort of area, and a little bit of resistance showing through in Benin and some more in Ghana. Life has changed. In the 7 years since we started this program, we now have little pockets of susceptibility and resistance almost everywhere else. It is so alarming, the amount of resistance that we've now got out there, that in fact last week the Global Plan for Insecticide Resistance Management was launched to try and get international effort moving together to work out how we're going to deal with this. So we've had an enormous sweep of pyrethroid resistance go through. But what did we do? Well, we collected the mosquitoes, we looked at all the candidate loci. Now, the target sites for the insecticides are easy. We've only got 3 target sites. But when you look at the metabolic routes, we've got 190-odd cytochrome P450s, we've got 60-odd esterases, and 35 glutathione transferases that could be involved. And then we've got a couple of transporters and a couple of cuticle genes that could also be involved. So that gives you quite a large diversity to have to try and work with. We needed to rattle through those quite quickly and say, using the sort of genome of Anopheles gambiae that had only just been published when we sort of started, which of those were important, but knowing that we were going to come up with these sweeps of pyrethroid resistance so that we needed something happening. So I've told you that the pyrethroid resistance is swept through Africa. Those of you who are good on coastlines will know this isn't Africa, this is Mexico. But this is looking at Aedes aegypti, where we got a similar sweep of pyrethroid resistance going through over a small number of years. So we were looking between 2000 here and 2007. Some of these are below the baseline because we started with a little bit of resistance in some areas and then it declined for a few years. They put pyrethroid in and it took off like a train. So you don't get years to worry about this, you get months. And so you need a detection system and a diagnostic that's going to give you your answer to have I got resistance and is it important within a few weeks so that you can actually plan what you're going to put in place. We put these onto a TACMAN platform fairly simplistically to be able to take through the different sort of PCR sort of probes. And as I say, from a single mosquito then we can get all the information sort of coming through. But you need to be able to work out what genes you're looking for. These are just the Plasmodium falciparum sort of systems which show you again visually. So this mosquito, for example, is infected with Plasmodium falciparum. Here we have the other Plasmodiums, Malaria, ovale and vivax, with different infections, but not with falciparum on the sort of set there. So we can look at the different sets there. Methodologies sort of published. We haven't been able to put a diagnostic kit out here because you will need to actually go work out first what resistance genes you have and then monitor them rather than just being able to buy a diagnostic off the shelf. But we did want to work out how could we use this in practice in the field and what did it tell us in terms of the sort of set there. So with the P450s, we've been having to look at the whole 190 odd of them. For those of you who've done any biochemistry with cytochrome P450s, you'll know that is not an insignificant amount of work. You need to set up the oxidative chain to be able to look at what's going on as you take them through. But we've been able to identify that these cytochrome P450s here are metabolizing, in this case, deltamethrin. These cytochrome P450s here don't touch it. So we now know for all of the 190 odd cytochrome P450s and a number of mutations on those cytochrome P450s, which are the ones that we need to worry about, which are the ones that we don't need to worry about that might be upregulated. And here's the way we actually sort of take this through in the field. And I'm giving you a real example here from Bioko in Equatorial Guinea, where 2 or 3 months ago we went in. Larval sampling still. We want insects that have not been exposed to insecticide to start with. We rear those to adults, and then they go 3 ways down the chain here. We expose them to deltamethrin, bendiacarb, which is the other insecticide they might use, and the controls are the one that you don't expose to anything at all. So those are controls on the sort of set. We take the live mosquitoes, the dead mosquitoes. That's as much as you can actually do sensibly in the field, at which point we still have to bring it back to a high-tech lab, I'm afraid. We've had no means of getting away from that. The mosquitoes then go 2 routes. We take DNA out of them. That allows us to do the species, and from the same extraction we can tell you whether they're infected or not, because the parasite material will have come through with them. We take out the RNA extraction, and we do 3 different replicates of that to make sure that we've got the right quality controls in there. Whoops. That was the idiot button, by the way. I pressed the wrong one, so I was bound to do that at least once on the sort of set here. We make sure we've got quality control of the RNA, and we run those through into microarrays. The microarrays then are high-tech, but it's really sort of putting it into this sort of black box here that produces what we call a volcano plot. And we're doing comparisons of a fully susceptible strain of mosquito, the non-exposed, which is the control within the field, the bendiacarb or carbamate-exposed survivors and the deltamethrin sort of survivors. And this is the kind of volcano plot we get from there. We're really interested in the genes that are upregulated in this quartile here, and particularly these over here. What are these? Because those are the ones that are massively overexpressed in the mosquitoes that we're looking at. So if you look at those different comparisons there, we find that we're getting quite a lot of variability between the fully susceptible mosquito and these three different populations here. This is a lab population that we're comparing them against. But when you compare the three different sort of blocks here, we actually find that we're not getting a huge difference between them. So what that's starting to tell you is you probably don't have a problem with metabolic resistance in this particular area, even though you've got some resistance to deltamethrin in particular coming through on the sort of set. You won't be able to see this, but the two dots that I showed you in that quartile right up the far side, this allows us to identify what these are. These are these two genes here, and they're oxidative stress genes. So what this is telling you is that these mosquitoes are stressed. By sticking the insecticide there, you've upped their stress level hugely, but they're really not terribly strongly resistant within the sort of set. So again, it's telling us these aren't genes that we need to worry about too much. It's just a normal stress response in the mosquitoes. So with this particular example in Bioco, we were able to show quite quickly then that the common metabolizers, cytochrome P450 metabolizers in Anopheles gambiae, were not overexpressed in this population. We didn't have some of the other putative detoxification genes that we see in other strains of mosquito upregulated. We did have a target site mutation, very low level resistance that was pulling through, and we didn't believe that that was actually causing us a problem in terms of control. We looked at the other target sites. We could show that they were fully susceptible in terms of the mutations on the acetylcholinesterase, and they had a relatively, I say, moderate frequency. 42% of the population had the mutation on the sodium channel. But again, in isolation, this is not operationally significant, although you will see it in a WHO bioassay. So to move on sort of finally then, we wanted to know what that did to infection rates. So our prediction, in fact, was that we were not having a problem here. And then we went back to the samples that we had sitting from window traps, because we couldn't do that on the material that we collected as larvae, obviously. And we could then, from that dead material that was down in the freezer, track for the specific resistance genes we were interested in and say, were the resistant insects more likely to be infected or not? And the answer to that was they were not. In fact, the insects that were carrying the insecticide resistance genes had less infection in them, had a lower infection rate than those which were fully susceptible. And if you looked at the sporozoite rates then, in the general sort of population after they'd sprayed pyrethroid, here was the level pre-spray. 2 months after they'd sprayed pyrethroid, it was right down. And then as the insecticide decayed, it started to come back up again. So we could show from the historical material they had there that their pyrethroid was still working. What we've then been able to go is go back into Bioco and advise them that despite the fact that they're seeing some pyrethroid resistance by bioassay, they can still use pyrethroid in a rotation within the sort of set. Now that saves them around £600,000 per year, even on an island as small as Bioco. And so the sort of cost of doing a couple of weeks' work like this and sending some samples out to the lab has saved them a significant amount of money, and they can put in a system that actually works better than the bendiacarb that they'd shifted to. So I think we now at least have a system where we can get advice coming into the system. We don't yet have a simple way of taking these right down to a very easy diagnostic that you can do the whole process in the field from. But as soon as we've done the microarray once, we can then pass it down to them in the field. And we think that probably every 3 or 4 years, unless there's some big shift that goes on there, would be the only time that we or others who have the ability to do the microarrays will need to go back in. So I hope in the time that I've had, I've managed to persuade you that product development partnerships are of use. In the 6 years that we've been going, we've managed to stimulate industry to develop new insecticides, and we will have the first new insecticides coming through for public health in 35 years, in the next year or so. We have got diagnostics that will quantify insecticides in the field, and they're actually being used. And I think the great thing about that is, as soon as we took these out and gave them to people to say, does this work well, we then had them coming back and saying, where do I order these from? Can you produce them? I need to put these into my program. So that tells me we've really got something that people want to use. And we do have at least a system of using the genomics and genetics information that's been coming through Anopheles gambiae and turning that into something practical that will allow us to monitor operationally significant resistance in the field, give advice to the programs, and turn that into a difference in policy for the control programs as we take that through. I do hope that as we put the new insecticides in, we will learn the lessons of the past and not just put single insecticides in, but make sure that we've got proper insecticide resistance management programs in place from day one. So we're hoping to get more than one new insecticide class launched at the same time so that we can do that, although that's a fairly tall order in terms of being able to take those through. But I think from a standing start in 6 years, we've covered a huge amount of ground. And the paradigm shift that I was looking for on the earlier sort of slide that I showed you in terms of the market rupture, I hope in a few years' time to be able to change that DDT picture and have a very different sort of scenario as we move forward.